Now, that leads into my next question. How do you determine which method of treatment you will use on a particular condition?
Okay. Yeah, that's really depends on the condition, to some degree. Now, if someone comes in with fibromyalgia or Lyme disease, that's a thing that affects their whole body. It's a systemic
Yeah.
issue. Now, let's say someone comes in with a wrist issue, and I've got people that actually come into the clinic and they say it hurts right here. Doesn't hurt anywhere else, doc. It hurts right here where I have the X. We'll have a lot of knees like that, where they've already got the X drawn on their knee when they walk in.
Sure.
So with that, obviously with the cold lasers, I can target that specific area. I can treat the specific tissues I want. Also with cold lasers, I have tricks that I can do where we can basically do a nerve block of a chronic pain center. We can stimulate blood supply to the periphery. We can stimulate nerve supply to the periphery. So I don't just hang out where it hurts, but it is useful to know where it hurts, and if I need to target photons there, I can definitely do that with the lasers. Then with something that's more of a systemic thing, like I said, they turn on energy production. So if I have a fibromyalgia patient that has a neck flare-up, I can target the cells and tissues of her neck with the lasers, which is going to be helpful. But technically, all the cells and tissues in her body need more energy. So that's where I'm going to lay her on the mat, and that's going to help with the full body energy production
Right.
issues. And a full body
Oftentimes,
healing.
inflammation will cause the entire body to hurt.
Exactly.
And you can use those therapies to
Yeah.
reduce inflammation and increase circulation as well.
True, and that's another thing that both of them do is they increase circulation, the cold lasers and MS. Now the person, even though a person with, let's say, a wrist or knee I'm going to target with the cold lasers, it also would not hurt anything to do that, and it would probably be helpful as well. Some people, will wind up getting that, using it at home, and if they're only seeing me once every couple of weeks or once a month at the clinic, then they've got something they can do in the comforts of their home as well.
That was actually going to be my next question, so I'm glad you started talking about that. Can either of these therapies be used at home, or are they only in clinic treatments?
Okay, actually the answer is both can be used perfectly fine at home. The thing with the cold lasers require, someone that knows what they're doing to run them. Cold lasers, if it's in front of the body, if it's in front of your shoulder or your front of your knee, your wrist, you can easily.
I've done that before. You've let me use the cold laser to laser the scar on my arm.
Exactly. So we did that while we were singing Dairy Queen.
Yeah, that's
after
right.
the Toastmasters meeting.
And so we're not talking.
Yeah.
Just explain a little bit with the laser what size it is. About the
Okay.
size of your ink pen is what I used on this one, and then you have a
she's
couple
talking
of
about
different
this little
sizes.
$30 one that we used
Correct.
to sell at the clinic.
So we're not talking about a big, laser
Yeah.
machine like you would see in a sci-fi movie
And
or
we
a
have
medical facility.
we have other lasers in our clinic that are up to like $8,000 a piece lasers. So those are obviously above the price range of the normal individual. We do have some people that have bought a $1,000 laser or a $2,500 laser or even a $6,000 laser, but that's not real common. Normally people are buying the $1,000 or less cold lasers for use at home. The thing with the mats start at $580 for a belt or $710 for a mini mat, and so a lot of people can't afford those. So I have found that more people are apt to buy those than to buy the cold lasers to use at home. Now the other thing is, if we get a cold laser and let's say, it's that spot behind in the middle of the back where I can't reach.
Right. You have to have a second person there.
You have to have a second
implement
person,
the
or if
laser.
it's let's say it's the back of the shoulder. Well, if you don't have a shoulder problem on the right, you do on the left, but you can't find anyone to run on it. You do this and that, you're going to wind up having a right shoulder problem too.
That's true.
So we don't want that. So it's something with the cold lasers, we have to find the time to run it, and have to find someone to run it on us a lot of the time. The mat, we just simply sit on it or lay on it. The mat penetrates 6 inches deep. The cold laser, like the one I showed you, I pulled out of my pocket, penetrates 1 centimeter. The best cold lasers on the market penetrate 2 inches or 5 centimeters deep. Let's definitely have that be considerably when it comes to depth of penetration. But it really depends on where those target cells and tissues are, how deep do we really need to get to treat them.
Yes.
And that's part of what goes into my factoring which would be the best for each particular condition or patient.
And there is even some differentiation of how deep it goes between the mini mat, for instance, and the full size mat.
Well, actually, we both get the same depth of penetration, 6 inches or 15 centimeters, but the Pro sends in 6.5 times more of the far infrared healing.
And that's because of the amount of amethyst,
Exactly.
which is a
lot
healing
more amethyst in it.
healing crystal, which is involved in
exactly.
the mat therapy.
Yeah, so when we plug in the mat, we turn the heat settings on, the amethyst produces those far infrared long wave rays that go 6 inches deep into the body.